Changing an anti-eyebrow piercing is not for the faint of heart. This isn't just swapping out earrings at Claire's. You're dealing with a surface piercing, meaning the stakes and potential pain are higher. Be prepared, both mentally and physically. The first thing you need to remember is don't rush. New piercings heal in 6 to 12 months on average, and for something like an anti-eyebrow, you're looking closer to the upper end of that range. Attempting to change it too soon invites infections or rejection. Here's another thing. Your piercing was done professionally for a reason. If this is your first time changing it, go back to the place where you had it pierced. They'll have the right tools and sterile environment, worth every penny for peace of mind. If you're taking the DIY route because it's been over a year and your piercing is healed, wash your hands thoroughly. I don't mean a quick rinse under the faucet. Think surgeon prep. Use antibacterial soap and scrub like your piercing's life depends on it. Because it does. Grab saline solution or sterile wound wash. Clean the outside of the piercing area thoroughly. You might be tempted to use alcohol or peroxide, but don't. They're too harsh and can dry out your skin, which is the last thing you want. Now for the fun part, the jewelry. Choose high-quality materials like titanium or surgical-grade stainless steel. Cheap, cute options might seem appealing here, but trust me, they're an infection waiting to happen. Quality over aesthetics every single time. Use sterilized gloves when handling the new jewelry because clean hands aren't enough. Think of your gloves as an extra layer of defense between your skin bacteria and your freshly cleaned piercing channel. Never skip this step, no matter how confident you feel. Carefully unscrew the bead or attachment of the old jewelry. A pro tip, use a microfiber cloth or grip tools to ensure you don't drop it. Dropping it on your bathroom floor is the kind of horror movie you don't want to star in. Now, gently slide the new jewelry through the channel. It should go in smoothly. If it doesn't, stop and reassess. Forcing it can cause damage, irritation, or even rupture the tissue. Yes, that's as painful as it sounds. Once it's in place, secure it tightly, but not excessively. Over-tightening can irritate the skin, while leaving it loose increases the risk of it falling out. Aim for snug, like a good t-shirt fit, but for your face. Some redness or mild swelling is normal immediately afterward. However, if it persists beyond a day or two, or if you experience severe pain, unusual discharge, or heat around the area, consult a professional. This isn't the time to power through. Aftercare remains critical even after changing the jewelry. Continue cleaning the area twice daily with saline and leave it alone otherwise. The less you touch it, the lower your chances of introducing bacteria. It's basic but effective advice. Finally, remember that piercings are an ongoing commitment. Improper care can lead to rejection, where your body slowly pushes the jewelry out like it's evicting a squatter. Treat your anti-eyebrow piercing like a prized possession. It's on your face, after all.